Hello, I'm Steven Zinowitz, President and Chief Executive Officer at St. Barnabas Medical Center. I'm here today with Dr. Gary Rogel. Dr. Rogel is our Medical Director for Cardiovascular Services across our system. And Dr. Rogel is going to talk a little bit about February is Heart Healthy Month. Dr. Rogel.
So February is a real important month because what a lot of people don't recognize is that about 1 out of 4 deaths in the United States are due to cardiovascular disease. That's 600,000 people every year. Every year there's about 700,000 heart attacks, which equates to something in the vicinity of 1 heart attack every 40 seconds in this country. The interesting thing about cardiovascular disease is that it's largely preventable in many cases. So what I tell many of my patients is that half of their care and their long-term outcome is up to them. The other half is my responsibility. Sometimes that changes a little bit, but from the perspective of keeping yourself healthy, and this is unusual for a disease which can be so lethal, from the perspective of keeping yourself healthy, patients really have the power to do that. And that's typically by lifestyle management. So patients have to, for one, stay very, very active. The more active they are, the better their outcomes are going to be. And we know another very interesting metric, up to 40% in the United States are obese. 20% of children are obese. So we're not doing a good job with that. And then we have to manage hypertension, high blood pressure, diabetes. You have to know your numbers. You have to know what your cholesterol is. And to a degree, you probably could do something about your family history, because we know that if you observe all of the lifestyle things that we recommend as cardiologists, that you may have the ability to change how your genes are manifest. So patients have a lot of power to determine their destiny with this disease.
I like it. Dr. Rogel, thank you so much. You've covered so much in such a short amount of time. And one thing I walk away with is that let's manage the things that you can manage as a patient. Very important.
Absolutely.
Great. Thank you.